If you read through the 94 calls to action from the Truth and Reconciliation Commission, it's clear that every institution and system across this country has urgent work to do. Right now, we're going to focus on healthcare.
That's what we're going to do. And our next two guests are at the forefront of reconciliation in the healthcare system. Dr. Melissa Richardson is the strategic lead in Indigenous health at Women's College Hospital. And Kawennanoron Cynthia Loyst is the elder in residence and traditional healer at the clinic. And we want to welcome both of you to the social today. Thank you for being here. So, Dr. Lisa, I'm going to start with you. The Ghana Wishkadawe Center for Wise Practices in Indigenous Health, it actually opened in 2018, relatively recently. So let's begin with why the center was created. And as an Anishinaabe physician, what is the gap in healthcare that you wanted to fill with this center and your care?
Thanks. The reason we opened the center or felt that we needed to do this is because of the ongoing racism that Indigenous peoples continue to face in healthcare, which means that our peoples get a different level of care. And there was just a story released this week of a Haida elder out in the West Coast who went into an emergency room with severe abdominal pain and was discharged from that emergency room, went to a second hospital and was found to have acute appendicitis. And so this is the sort of thing that we're trying to address. We want every single First Nations, Inuit, and Métis person who enters a clinical setting to receive the same high-quality care that every other person receives.
Now, Cindy, you're the elder in residence and traditional healer at the center. How does your approach to a patient differ from a Western medical one?
Well, it's a holistic view. It's looking at the mind, the body, the spirit, and the emotions. And to get the whole life story of an individual, not only the reason why they're presenting, but to look at the whole picture and to try and connect the dots and to pay close attention and to nurture the fire of the spirit and to build that fire.
Love that.
As we're watching some of this, which is it is really beautiful to watch, but Dr. Lisa, as we watch this, this is really about respecting, you know, Indigenous traditional methods of healing within the larger healthcare system. And traditional healing, it's a really different, completely actually different knowledge system than the expertise and training that physicians receive. So what is it that you wish that more people knew?
I want people to know that Cindy and other traditional healers have done years and years of training and have very clear and specific areas of expertise and gifts as healers. So I went to school for 14 years after high school to become a specialist physician. We have many different specialties: internal medicine, primary care, nephrology, neurosurgery. And similarly, amongst healers, there are many different practices as well. So understanding and valuing that this is a very special area of expertise that Indigenous peoples carry with them. We need to honor and uplift that, and we need to value it in the same way we do other forms of medicine.
And there are many types of traditional healing within the Indigenous knowledge system. So, Cindy, would you give us some examples of the services you provide to patients?
Well, today's stories are a great example of the range of attention that one can receive. We're all born with a purpose, and we all have a spiritual mandate. And so one's identity can come into question. There are seeds of pain that get planted deeply within. So to go after that original seed of pain, because pain informs our life choices. And sometimes it can be incredibly dysfunctional, so we have to unlearn all of that. But when you know who you are, when you know why you're here, you can cultivate all of that and walk in honor of your ancestors.
Wow.
Dr. Lisa, you do a lot of education with healthcare professionals and also medical students as well. So when you're teaching them how to create a culturally safe environment for Indigenous patients specifically, What are you saying? What are you teaching? What are you emphasizing?
I want people to understand the history and ongoing experiences of Indigenous peoples, not just in healthcare, but in institutions like the justice system, like the education system. Specifically, I want people to understand the trauma that's occurred in residential schools, in the Indian hospital system, and how that will impact what it means to cross the threshold of any clinic, any hospital, enter any emergency department. And so how does one build trust? How does one really build and cultivate trust in a relationship between a patient and a physician or nurse or other care provider? Secondly, understanding that you need to look within. We all carry biases. We all carry stereotypes. How are those playing out at the bedside when you're providing care? So saying to yourself, as a practitioner, am I drawing upon a problematic idea or stereotype here that's leading to poor care for the patient in front of me? Am I saying, oh, you can't go and get this for some reason? So really being able to look within. And lastly, to understand the many different forms of healing and well-being that exist within community and have for thousands of years, and to really celebrate that and recognize it as important, such as smudging. So we have smudging, for example. Smudging kits that are available across our hospital and all of the different clinics.
Is it really? That's incredible.
If I can ask a follow-up question, I mean, I feel like I already know the answer to this, but I need to ask it anyway. Is there any training, as you know it right now, for anybody who wants to become a doctor in the Canadian healthcare system, for any cultural training, whether it is Indigenous communities or any BIPOC communities, that is built into the curriculum to become a doctor in Canada?
We have been advocating and fighting for that for a long time. And yes, I can say there are Indigenous health competencies now that are required. That's what the Truth and Reconciliation Commission Calls to Action Around Health said. It said every healthcare provider must understand Indigenous peoples and Indigenous history. It's slowly making its way into the curriculum, right? Any policy.
Very good.
It's really good to hear.
Yeah. Cindy, you've worked one-on-one with many Indigenous patients. What's their feedback been like? What's their response to the treatments that they receive?
Incredible.
Yeah.
There are instances where people spend years and years grieving, so much so that it impedes their daily activities. So when they understand the journey of the human spirit, that we're here on earth for a little while and we leave, and what does that journey look like? That the spirit carries on. Our teachers tell us we come from the heavens and that we return when it's over. Everybody returns. So when you learn about that, you're not afraid of leaving this place. You're not afraid to die, and that the spirit always walks with us.
Oh, it's beautiful. We don't have a lot of time, and I have another question for you, Lisa. I've got to ask the significance of this stunning being.
This is my eagle fan, and I use it in healing ceremonies. It helps me to speak. The eagle carries that first spiritual law of love, to be unconditional, and to bring great blessings to all the people here.
Oh, wow. Oh, that's beautiful. Thank you. And lastly, Lisa, you kind of mentioned this, but when we discuss this and trying to have equality in healthcare for Indigenous peoples, how does this factor into the bigger conversation about reconciliation?
I really want everyone to remember that we all carry a responsibility for reconciliation, but in particular, non-Indigenous peoples must step up and be accountable and do that work as well. Right. Because we often, we've created this beautiful center for Indigenous peoples as Indigenous peoples. We've done that because we've had tremendous support and space created by all of the non-Indigenous folks as well around us. And that's really important. And lastly, that we need to understand that truth exists. The Truth and Reconciliation Commission contains the word truth for a reason. Let's look at the truth of what's happened in our country and continues to happen.
Wow. Dr. Lisa, Cindy, thank you so much for joining us today. We appreciate you greatly. Thank you so much.
Thank you.
Hey there, what did you think? Drop your comments below and join the conversation. And don't forget to like and subscribe so you can find more on everything from food and fashion to pop culture and current events. See you soon.